Hello viewers from wherever you're watching us from around the world, welcome, and you're watching QTV, the Gambia's first private TV station, and we're broadcasting from our studios here on Kairaba Avenue. My name is Aliou Cissé, and we're here today to engage our guest on the ongoing vaccination campaign supported by the COVAX facility under the Global Alliance of Vaccine Initiative. And of course, UNICEF as a partner is also supporting this cause, and that's why we have two gentlemen here in the studio. I have on my left, I have Musa H. Kamara, who is the program officer, expanded program on immunization. That's the EPI program. Mr. Kamara, welcome to QTV.
Yeah, thank you. Good evening.
Yes, and on my right, I have Mr. Umar Jaite, who is a Health Communication Officer at the Ministry of Health. Mr. Jaite.
Okay, thank you very much, Mr. Cissé. Thank you.
Let me start with Umar. I mean, like I said, you are the program officer at the expanded program on immunization, the EPI. I mean, what brought about this idea of trying to embark on another vaccination campaign of COVID-19? People perhaps might have thought COVID-19 is normal.
Okay, thank you. This is very important. Actually, you understand there are both country and global targets as far as COVID vaccination is concerned, at least for people to go back to normalcy before the pre-COVID era. So experts, require that each country at least to vaccinate 70% of its population. And as we speak, we are about 20. So we still have 50%
covered
to continue. And then, of course, the vaccination is aimed at, making this vaccine get closer to the last targeted individual in the country. At every village, every bantaba, every community in the country. So, you increase access in order to increase uptake. That is why we are out to do the campaign, and of course, it's a country-wide campaign, and we targeting ages from 12 to above. And it starts on 11, and the campaign proper will extend to the 22nd, and then vaccination will continue thereafter at every public facilities where vaccination, what we call locally called NOS, is being conducted.
Certainly, there's that hesitancy as far as, accepting this vaccination because of people misconception about this whole vaccination. What makes you think you can achieve where others have failed previously?
Actually, yes, of course. Although we thank God, there have been a lot of changes as far as people perception is concerned generally. Although, yes, if you remember previously, there are a lot of talks concerning about the vaccine safety and others. And as an expert, I remember we came here, we told people, we understand with all the concern that people have, but we understand how to address the concern. So we know very well. And today, I think a good number of the populations are with the belief that what have been said before about this vaccine is not true. Yes, we understand before the vaccine proper it came in a lot of talk. This is why, and that's why as a program, as a ministry, we had it tough. But you understand, we are all employed to face challenges. Without challenges, we are not there. So, but together, a lot of improvement, and people believe in us as they have to believe. They used to believe in us, because vaccination is not a new thing, Mr. Cissé. Way back in the early 60s to the 70s, 1979, a program was established, and because of this, then we have what we call the FUSIBA, the measles, the meningitis. We are responsible a lot of killing a lot of Gambians and Gambians. Luntangs, and because people coped, they trusted the Minister of Health and trusted the health workers. And today, you understand, it's about more than 20 years we don't have a recorded death of most of those cases now. When, for example, in 2019, 2018, we understand there was outbreak of measles, for example, in Europe. You understand, in America. You understand, when we are not there, So it's like the Gambia is proving its existence in the nation, in the world as a nation. You understand, by following global formulas to address global problem. You understand, the Gambia is part of the world, so that's why we have a flag in UN. So whatever the global leaders and experts put up as a strategy to address any goal, whether it's whole the educational, developmental, or health-wise, the Gambia subscribe to that, and that's why we are. And we thank you know, our people who have been all through in the early 60s to 79 to date, who have trusted the Minister of Health, and despite all hurdles, we are there, and gradually we'll be there.
Thank you very much, Mr. Kamara. Let me bring in Mr. Jaita here. You work at the Ministry of Health as a communication officer. What is the role of the ministry in this whole campaign?
Okay, basically the ministry is spearheading the campaign, as Musa said, under the EPI. So with support from partners. So the ministry, they are using their human resources. They are using their capacity, they are using their strategies, because Ministry of Health, they have been doing campaigns, so they know very well how to do the campaign. They have networks of communicators, they have networks of vaccinators. So Ministry is hiding the whole thing. As we speak now, our vaccinators are around the country. As Musa said, they are targeting Bantabas, they will be targeting schools, they will be targeting our health centers, all under the direction of the Ministry of Health. So the ministry is basically spearheading the whole thing that has been supported by our partners, as Musa said.
Well, like Musa said, I mean, the misconception around this vaccination, I mean, what is your department doing as communication officers to help change people's mindset or people's concepts about this vaccine in order to accept it as, you know, being real?
Okay, before the vaccines are already here, we the communication officers, we heard about so many informations about these vaccines. So before the vaccines arrive, we have to also prepare to counter some of this information for people to go and get these very important vaccines. So we have been monitoring some of these rumors that are coming out, like if you take the vaccine, you will die. Within 1 year, like if you take these vaccines, there are some DNA things that they are putting on you to monitor you, to track you, or if you take these vaccines, if they put a phone on you, it will stick. So some of these rumors have been circulating since even then, before we have the vaccine in the Gambia. So we try by all means, we do risk communications across the country, and we have been on TVs, on radio stations. We have involved our traditional communicators at the community level to make sure that the public is aware and they know the fact that these vaccines are very safe, and they are like other vaccines that the community have been taking for years, as Ministry said, as Musa said, because the Gambia, for vaccination in the country, for vaccination around the world, we have so many success stories in terms of that. So vaccination is not a new thing in the Gambia. So the Ministry of Health is aware of these challenges, as you said, the communication side. We are also been engaging the community continuously engaging the community about their concerns concerning these vaccines.
So what do you think you should do different to be able to change the mindset of the people?
Okay, what we are doing, and we are seeing the benefits, is involving the community. That is, we'll go to the community, we sit with them with their at their Bantaba, with their chiefs, with their alcalos, with their imams and priests at the Bantaba. We have a talk with them. We involve them in our discussion. So by that, they will raise their concerns, and we will settle all their concerns in their presence, and any question they might have, they ask us, and we try to answer all those questions. So by that way, their doubts are cleared, and we are seeing the vaccination index increasing.
Thank you very much, Umar Jate. Well, viewers, you're watching QTV, the Gambia's first private TV station, and we're broadcasting from our studios here on Kairaba Avenue. With me in the studio are officials from the Ministry of Health, and we are discussing about the ongoing vaccination campaign against the deadly pandemic. I have Umar H. Kamara and Musa H. Kamara and Umar Jate. Musa, let's now look at the response. How is the public responding
to this vaccination?
We're
doing great, actually. As we speak, since the commencement of the campaign on the 11th, by the 4th day, we had 29,000, and over 89% of those 29,000 vaccinated are new vaccinations. This tells you, despite all odds, you understand also we are in the rainy season, and we understand these kind of obvious challenges. Our vaccinators are doing extremely well. They are going to farms. They are targeting people late in the provinces who close works from the evening. You understand? This is a lot of how extensively people are going out there to get people vaccinated. So it is going well, and it extends to the 22nd, and vaccination will also continue. However, we have a challenge because shortly before June, we had a vaccination round. We had about 100,000 people vaccinated, and most of them were school children with the Pfizer vaccines. And for the Pfizer vaccines, it's targeting age 12 to 17. Primarily, that's what we are using for the Pfizer, and for booster, we are also using it for booster. But most of those people who got them, limited people are coming back. We understand schools also are closed, so that's this is why we are appealing for parents who are out there to ensure wherever the teams are, let these children come out, even if they are on holidays, because they already take their second dose. Because for one to get at least the minimum expected protections, you need to take at least a complete dose. I mean, for Pfizer, you need to get 2, except unless if it is a booster dose. A booster, like, for example, if you get a J&J before, or you get 2 AstraZeneca before, and after 3-4 months, you can get a booster. It means now you want to, because this vaccine, once you get the vaccines, I mean, you have immunity rise, and you understand? After sometimes it goes down. So when you take the booster, it rise also. So that is just the challenge for now. But apart from that, I mean, everybody, a whole lot of work is going on, and we appreciate what's happening, but we still want people to trust us and to come out and take these vaccines.
I mean, earlier on you talk about Gambia covering just 20% of the 70% target. During this campaign, what's your target?
Yep, actually we targeting 70%. We want to, if you look at like we are in the how many months have we been in July, right? So it's August. So we barely have 4 months to December. And it is our aim to get this target by December. I mean, getting 50% in December, we're talking about almost 1 million, 1.1 million people. You know, that's a lot of people. So, you know, and we've so far only vaccinated about over 400,000 vaccinations since the inception. It means we have to do very, very, very well to get our people vaccinated. Although there are a lot of progress, brother, because it took this country nearly 65 days to register 4,000 vaccines. You remember the 4,000 vaccines? It took us about 3 months, 60 days. We're talking about in the 4th days, as we speak today, as at yesterday, we had 29,000 people vaccinated. And it took us more than 60 days to vaccinate just 10,000, the first insult. It tells you how the confidence has been built up, you understand? And we're also in the rainy season. These are obvious facts that we have to accept. And actually, our intention is we have to have intensive cycles. This is what we call intensive cycles. Intensive cycles mean every month we go extensively 10 days to reach at every community and every bantaba, you understand, possibly every ward. This is our target in the remaining four months. But after these 10 days also, we expect to we expect to have a continuation cycles also. A continuation cycles, it means even after the 10 days when you go to the health facilities, we will have, as part of our plan also to have teams stationed in strategic location during after the campaign. So and then these are a whole lot of package we have. You understand. Although we have not got what we want in terms of coverage, but we are hopeful that we will be there, and with support and the confidence that is coming up, we believe. Now a lot of youths that are traveling, they know. Now if you cannot travel without this COVID vaccination, and sometimes it's also important, Mr. Sise.
It's a reality. Just yesterday, a colleague of mine was coming from Abuja, and he got turned down at the airport because he took 1 jab. He's not fully vaccinated, so he has to reschedule his flight to come today.
and the challenge we have as a country, sometimes you get to globally, internationally, you are required to take the vaccine 14 days before you travel. And the challenge, among the challenge we have, even at the office level, is that people come last minute. Look, let's do away with this usual Gambian thing. Let's do things on time. Let's not take it because we are traveling. We are taking this vaccine to build antibodies that will recognize the virus once it can get into your body in the first second of it entering in your system. And it takes it 14 days before the signs start coming. So take the vaccine, build up soldiers that will be ready to start fighting before even that the virus has entered in your system.
Well, luckily here at QGRIP we are all vaccinated. Okay, now Umar, let's look at the disadvantages of not taking this vaccine.
Okay, disadvantages of not taking these vaccines are numerous. So one is you are exposing yourself to the virus, which we all know that it's dangerous, it can kill. That is one. So two, the second disadvantage is you are also putting some people at risk, those at home. You know, this virus usually, it has a very dire effect on those with comorbidities. So those with diabetes, those with hypertension, or chronic diseases. So those ones are at a high risk of getting very chronic, high risk of getting this disease, and you are exposing them to this virus. So if you are not vaccinated, you are exposing them. You are exposing your community because you are part of you are part of a community, and you will be moving from one place to another. So you are also giving difficulties in getting that 70% that we are trying to get. And also as a country, in the Gambia here, most tourists are not coming here because their countries will warn them, don't go to Gambia, they are not vaccinated. Don't go to this place, they are not vaccinated. So Gambia, we are very much dependent on tourism. That is why most tourists are not coming, because their countries advise travel against Gambia because of the low vaccination rate. So not taking COVID vaccination it has numerous effects that are very detrimental to you as a person, to the community, and as a country as a whole. So that is why it is very important, especially the youths. The youths, they think COVID-19 is not their problem. If they have it, yes, they will have the virus and it will go off. But they can transmit this virus to very vulnerable groups. That even now we are seeing COVID cases rising. As we speak, we have 40 cases.
I was coming to that. How
yes.
prevalent is the virus?
Yes, we are having 40 cases, and it has been more than almost 2 months we have not seen dead. But our last sit rep, we have seen 3 deaths. Oh. And 1 on oxygen. That one it has been almost 2 months we have not been seeing that. So it's high time for people to pick their masks, to pick their hard-nosed material, and to start the fight proper. Yes, we have to re-energize ourselves against this virus because it is coming.
So what are some of the signs, if we can just remind our viewers,
yes,
some of the signs that we should look out for? I mean,
yes, for COVID, some of the common signs is that is the coughing, a dry one. You might have this. You will have a problem smelling or tasting. These are all very important signs of COVID. You might have some headaches. These are all very important signs if you see that on yourself. And the thing is, those who are becoming positive are those who wish to travel, because those are the people who are coming for testing. So most of the population sitting home are not coming for testing. So we can for sure say that COVID-19 is increasing in our population, because those 40 cases are all those people who are not suspecting themselves. They want to travel and they want that certificate, so they come to test and they will find that they are positive. So that means
I find that very interesting, Mr. Kamara. I'll bring you in here. I mean, some people want to travel, they go and do the test, they have no signs of COVID-19, and they tell you you are positive.
Yes, yes, because you know COVID gets into the system. What we call the sign and symptoms comes after 14 days. You understand? So after 14 days, this is why globally. Today, there is the most important global tool that, the Gambia need to understand that. There is the #1 tool that is available to fight, to get us to normalcy, is the vaccination. Because once you are vaccinated, then some antibodies are being created by your blood system. And then you wait, and the first second that you contract the virus, so they start fighting. So, but you only know that you have something that is signs and symptoms after 14 days, mostly. This is why you see healthy individuals who don't feel anything, and they want to travel, but but it's a law, it's a requirement they go for screening, and then found that they are COVID positives. So that is just the thing. So it tells you need to develop the soldiers in your system, so that the very first second this thing comes into your mind, something is there to fight this disease, even if before you know that you have the disease. You see, it is just very intelligent. It's not the serious way of that's the fuller way of exactly. You understand? Yeah. It's very important, and it's time that our people need to understand that. You understand? So it's better. Look, vaccination is not new in this country. You understand? We have diseases in the 80s. In 1965, somebody told me there was a distinct one about 50. Around the 64, 65, 50% of our under 5 we are dying. 50%. You can imagine how many Gambian people used to die at that moment. And it was all because of, vaccine-preventable diseases. When these vaccinations start up in this country, like the Fusiba, you understand? We talk about chere, measles, yellow fever, tetanus. You understand? Then we have this, what do we call Yaradals, Yaradals, Bonototo in Mandinka. So these are common names that people have. You understand? A lot of deaths that used to happen in the past. And then this meningitis also. But look, what happens? Two things happens. Government did its parts. Trained the health experts, brought the medicines, the logistics, and the community did their part. Our parents, brother, the pavements were not like this. It was not glittering like this, brother. There was no electricity in almost most places in this country. The roads were not good, brother. But our parents, they carry their children on foot, 10 kilometers, to ensure that people are vaccinated. This is why today, this is just history. Even clinicians that are practicing, hardly they see kind of, practical diseases. And they are here. There's only one disease that has been eradicated so far globally, the whole country. Only one disease. So the meningitis is here, the measles is here, the yellow fever is here. But because there is adequate immunity, defense system in Gambian bodies, this is why it is not coming. Look, one day it is our hope. That's why regardless whether the pandemic continues or not, I want to assure the Gambian that these vaccinations have to continue. Like we continue the North team. COVID vaccination will continue. There will come a time we will just come to the clinic and everybody get. Unless we get this virus out of this world. So we have to prepare for vaccination. Not only because there is a this pandemic, we have what do you call the cycles, it comes. And one more long, one more sort of care. After some time it just comes. After some time it just comes. But regardless, the immunization as a program is been given the mandate to ensure that the Gambian visitor and Gambian child is protected from diseases that you can protect through vaccination. And we will not relate in this mandate. We will work together with the people.
What type of vaccine are you administering?
For the COVID?
Yes.
Yeah, for the COVID, right now we have three types of vaccine in country. We have the Sinopharm, and which is you need two doses also vaccine. And then we have the J&J, it's a single dose vaccine. And
that's the Johnson, right?
Johnson and Johnson.
That's the one
vaccine.
I took.
Yeah, the Johnson and Johnson. And then we also have the Pfizer. These are three vaccines that they have in but they are all good vaccines. So we are using the Pfizer for now as a primary dose for the children under 17, 12 to 17. But we are giving it also as a booster for those people that got already their required doses before and they want a booster. So that is what's happening for now. Yeah.
Omar, earlier when you talk about trying to use the Bantabas and nose and aside from this, what else are you using to reach out to people?
Okay, as one of the strategies we are using is to be in here. So Directorate of Health Education and Promotion. We have been in because we have regional health promotion officers across the region, so they are all doing their special programs in their regions. So so that is what the ministry is doing. They are targeting anywhere in the public. We are targeting Bantabas. We are using the Kanyalangs. We are using them very well. They are part of our communication network that we are having. So the Kanyalangs will be going. Because they perform usually in our traditional ceremonies, so they will be preaching COVID there. They will be preaching vaccination there in our ngentes. They will be preaching this. So these are all strategies the ministry is using. So we are also doing radio talk shows. We are doing TV talk shows. So the ministry is doing everything that they can to reach to people. Radio talk shows, TV talk shows. We are on communities. We have regional health promotion officers, we have community health promotion officers, we have Kanyalangs at the community level that are members of the community. So those members, the community trusts them because they have been doing this kind of job for community for years. Yeah. So that trust has already been built. So that one, it is helping us very much. And we are
but maybe perhaps some people might say, okay, things have changed. Maybe those Kenyans are just doing that because they are paid to do it.
Even if they are having something else there, but that trust is there, and we are seeing the response from the public concerning what the Kanyalangs are doing. They have been with us. We have been working together, and they are doing a great job. And also we have been involving traditional leaders. We have been involving alcalos. We have been involving chiefs. So these are people that community trusts. So they are community leaders. The community listen to them, so we have been involving them in our activities, and they help us in mobilizing people for us to increase the uptake of these vaccines.
I mean, earlier on you talk about what the concept that people have, that those misconceptions about the jab, if you take the jab, if they put phone on your body and all those things. I mean, what are some of the side effects, or after taking the jab, what should we expect to experience after taking the jab?
Yes. So
because some people say, okay, I'm not taking it.
Yes, yes.
Are those signs normal?
Yes, they are normal. This is a pharmacological intervention, so side effects are expected. Even if you take paracetamol, that side effect is expected. Side effects are expected, but not everyone has this side effect. And most side effects that people have is you might have pain in where they vaccinated, you might have some headaches, some fevers, but that will go off within 1 or 2 days, they will go off. So those side effects are expected, and taking that side effects should not be the reason for you not taking the vaccines, because the advantage of taking the vaccine far outweigh the disadvantage. So it is very important for people to take it. In a very, very, very rare cases, you can have allergic reactions. In a very, very rare cases, that is 1 in a million. So we have not had any in the Gambia as we speak. That is 1 in a million, and our health workers are very much trained on that. So if that happen, our health workers are trained to deal with it. Yes, our health workers are very much trained to deal with it.
Yes, I want to. You know, look, we understand the concern of the people. You know, we talk about safety.
Yeah.
I mean, I keep on saying, people have to understand there are safety concerns. But as experts, we understand how to ensure their safety. It's not only about the manufacturer, but even how do you handle the vaccines, how you keep the vaccines, and how you administer the vaccine. I mean, as a country, the first thing we did was we developed a standard. We said we will only bring vaccine in the country that are approved by WHO. This is the highest standard. There are a lot of vaccine manufacturers, and you know, countries have their independence in approving vaccines for themselves. So, but we decide that we will only get vaccine into the country that have the highest standard. That's what we said. And we decided also we will only bring the vaccine after training our health workers. As we speak, in every public health facility and most collaborative private facility, we have trained what we call AEI officers. You understand? Advanced event following immunization officers. Their task is to be alerted and having all this emergency drug, you understand, and also registers, waiting for just for complaints. And we have the national immunization experts, AAFI expert committee. They are independent organization that will verify every reported case. Because as a country, I mean, the Gambia is part of the world, and we need to. The Gambia is part of the world, and we need to prove our existence. We need to prove our existence. You understand? So, and we have to contribute to the information generation about COVID. So we don't want to hide anything. Anybody who get the vaccines and we have any reaction, report it. If it is normal, being that it's expected, it's normal. If it's not expected, so it will be reported and we will monitor it, and the expert will review it. So that is very important for us. So the Gambia is at par as far as globally. This is how vaccine safety is ensured. You have to train an expert that will review and record and also intervene immediately. And that for so has been met.
Thank you very much, Musa Kamara, who is the program officer at the expanded program. Immunization EPI. Well, viewers, like I said, you're still watching QTV, the Gambia's first private TV station, and we are broadcasting from our studios here on Kairaba Avenue. This is a live program, and we have officials from the Ministry of Health to discuss about an ongoing COVID-19 vaccination program, which is supported by the CAVAX facility under the Global Alliance of Vaccine Initiative. Of course, UNICEF is also supporting this cause. And like I said, I have Musa H. Kamara here and Umar Jaite. Umar, we will now try to go into the local language to better, sensitize people about the importance of this vaccination. We'll go in the Mandinka. Okay, like new vaccine campaign, member caring.
Okay, mira keri nga manyindo 7 vaccination campaign on the Ministry of Health bamina. So vaccine akumata baga because COVID ba nyami mbe alo na minke dunia, mbe alo na minke Gambia jang, and minke kan hansa mbe bakane. So vaccine sa ngawol soto mbako virus on mba face kan wala mba kel kan wala ka me vaccine odun pengola mi alon ko ikamota mokata puru ka fi balu ka COVID jankaro nyin kata ni balu comme ibaje han covid jankar keso dunde balo ko rek ibala sojarul balo na ko yim covid la rek tare ay akel ibaje sa nga ate mutala bar hana ya mutafana ate batandila comme aka modo batandida milman vaccine ota so ni vaccine ota niata rek balo ka sojarul so mel yalon ke be ma ko la ka en covid jankaro nyin ka kele so akuma ata ba ke pour ka ni vaccine ota because niata itamiata follow ite ke fon tankandile ni fon tankandi fana ila kebal mbaso kono mil because kebal mostly tolla ila baraw sojarol buga bambandi buga siare so ikaje nin covid jankaro e murake batandi bage but ibaje la niti ata ita tol sawndi la no fenko nyin ani molmi alon ko because sign hypertension diabetes isiata la bakko kam bag almost ita su kona ga kilim flati bol tarajel wol be la balo sojarol kata do yare na ibaje nita fana ya covid ta ibu mari fana tankandila ibe tankandila nin covid jankaro la iba community fana tankandila because imanda kala mi angi ba bundul lati ba fengel but han yata ni jankaro ete fon mutete mari fam because modul safo aman jaranga vaccine ta bar because ngata mata janko covid jankaro ba mutala ne vaccine ta pour covid jankaro muta aka talale de probability pour muta aka talale kenne bar han yata jankaro nye muta abuka garaaw ko aka garaaw modo la mi alon kam vaccine ota so covid vaccination akuma ata baga so ministry kabirin arabo min tambita on the 10 ya vaccination start across the country so ibatara le plan wol tole batara karam wol tole surtout dindingol because na vaccination campaign do min tambita dindin jama pengu across the country karam to dindingol so karamol ba soron dina but hansa vaccination oba continuer so wo kam malamba wulula be danna pour c'est dingol hakilo blandi ya fo vaccination lal natal pour ba dami dingol letaji fana sa vaccination because pour vaccine o tanko min di mola pour wo soto nyanta dose flatala so dingol e kelenata so pour yo tanko so vaccine o sa min dino mola fo yeta vaccine flota so wala namba wulula danna pour dingol mi vaccine ota because you have over 100,000 school children so pour ye finti yeta yem vaccine ota mi alon ko abe mako la bake aba su ko na mako la ba community mako because Gambia ba 70% ya target ko wala Gambia lafta jenin December jenin in sanka ba lafta kam mo keme lafa mo taw woro be vaccinate la so present dit in Gambia wo mo ko ne keme mo andorne vaccinate so hansa mo jama jele mi lanke man vaccinate so mbol ko mandila pour le fintina ye vaccinate an niaja fana niaji be musol linkel musol le fana ka finti kelti vaccination la bak andum ngaje ko covid mantoro mi anka kala mo kan andum na suwol kono kello breadwinner di kel kata nyindiro le kana suwo kono so nin sasa wol ma se mantora no ani wol mantora ta ka so bela barandi so wo kamala mba fala kel fana ye develop ye wule time vaccine ta because akuma dala pour ye fon tankandi hana manke ye fon tankandi ye la family tankandi ye mobe tankandi pour Gambia nga progress
abarka bake Omar Jati Musa just follow ngapon angale kamoto amin ni manke sinya prote alkafite pour ka mulu vaccine bari akamunta mo jama imalla ni vaccination ko wala munatina yamire ko akuma ta pour mulu finti sign pour que vaccination ota. Thank you very much. Ngamera umunyina karbe ko kumata bake. Munyanta finti like pengota because Gambia is part of the world. Comme Gambia bankilenti dunia bankol. Andu pengo fe me yalon ko dunia kambenta ko nyanta nyin kole akele laten. Fo Gambia fana faya tarandeje. Fo poverty ko lom fo education la kole al bank fo human right la kole al bank fo jate kende yalo. You understand? So akumata pour molbe finti because comme jate ya fo nyaming pengo nyin anyanda talale. Because di pengo manta economically abe mantorala comme taking into consideration about the tourism issues because yalam banko la vaccine rate be nyaming so luntangol ka hanyi kana o banko nyaming so you understand life is very expensive in other countries more man la fi sasala mu meke so mo kana fan risk pour sasal because after sasa ku jama senanoje so the other issues comme aya fo nyaming fana most of virus ni sotole covid soto andu asafanola that's the fact and you also have after covid effects this like tamanserol me yalon ko continuous niji kolea wo sama mo after effect me yalon ko mo sa soto comme na ni mol membe so ko me yalon ko covid corona ko soto ali wol nyininka because after covid kolea fanam be jen so you have continuous having difficulties in breathing and all sifa wol mu long term effect of the covid virus lati so and the other issues fanan wolom ko comme risk ni ikana yalong comme Gambia is a country of believing people. It don't be ngakatoke nkana ke sababoti pour ça ay janjang. Ay janjang.
Mom mo nyanta kala kaje ko as a source of protecting the order. The only way say okay no wolo mi pengota. Ni e pengota e soldero soto ni sasa na janni te ya kala mutafang so fembe le jato ko no min sa kelendi. Oto akuma ta bake.
Kumata.
Oto akuma ta bake ko wala ata.
Umar, just ngakacha COVID-19 mo jawa yini kai ka fo COVID-19 jan sign. Sasa ni abejan for sa atratale.
COVID bijanne andun sa fo mo le coming abala faka na fa.
Mo buka max dum kabuta
abala faka da so abala faka na because in tembento na last report ngam bonda tata fo mo tan nan kele mi virus o nyi soto na and wo mol wol batama cold amanga ko woli ajele ko yanda date wol batama cold en ay test ke doro yaje ko COVID be lale. So adim fana mo saba fata o wito nyun kono mo saba wol be fata and mo kilimba oxygen o mo kilim monta oxygen so wata ni lego COVID ning aba lafa kan kambiala wol tandi so wo kamala nsa fu mo le hansa COVID be janne so beti ata bake pour ngata ngam fantan kandala because mo mba o mba oxygen o kono hanni ata wo sa fantan kandino wo law letal because sa oxygen mo oxygen o kono bar hansa ade se fantan kandino oxygen o demba sirin so ko itemba sirin so se fantan kandino oxygen wala so akumata bake pour mo le finjeta yo vaccine ta pour ye fantan kandi mo oxygen wala pour mo be tanka 70% o nyesoto we move on
abarka bake jaita kule mela ka kumera bage pour mol beta in pengota kumera pour ye fan kanta jane ka sa ni soto tolbe mel be serigne tolbe nga vaccine ta le fe manke molla legi ne gema duga ci olabi tuti rek wa bi ko han man time bi mu nge dem waye soñu ko mu tinka ci lu gata rek lan mo waral vaccination programme bi ni la mota ngeen geynaat pour mëna vacciner tan nit ñi
mbokay jërëjëf ay c'est lu foog naa loolu am solo la because Gambia comme dama wax ne Gambia benn réew bi la ci réew aduna bi moo tax ne bépp pexe boo xam ne mbootaay aduna dañu taxaw pour xeex ko bépp coono so fu Gambia bokka ci so we have to comme dañu prove our existence as a country and we have to contribute to global efforts fo ñun tam ñu góorgóorlu suñu réew mi góorgóorlu yokkute nga xam ne aduna mu ngi koy xeex pour ñu tam fuñ ci def dara because su fekkee ne réew mi yëpp wér neen aduna bi wér ne Gambia wérut kon aduna bi wérut so ñun dañ ci foo ñu gis suñu boppa si góorgóorlu aduna bi pour xeexee corona bi ñun nag ministre of health te jàppale comme UNICEF ak yeneen mbootaay Gavi woon ñu am ne ñu wax ne turu de ko fàttali ko CDS ñu amoon support pour def campagne yeneen campagne yi tam alhamdulillah comme WHO ak lot of comme with the support of our partners amoon nañ jàppale pour def campagne bi nag jubluwaay bi mooy pour ñu gën a ñu ñëw ak doole pour mën a àgga si dëkk bu nekk penc bu nekk su ko defee nit ñi mën a jël pengu bi waaye nag pengu bi dafay continuer after campagne bi sax campagne bi ñu ko dooree alxamis incha allah dafay continuer ba on the 22nd waaye after loolu itam lopitaan boo dem boo xam ne noos am na fa da nga am pengu bi nag dafa am njëriñ because soo jëlee pengu bi sa yaram bi dafay defar lu ñuy soldaar yu nga xam ne soldaar yaram liggéey soldaar yaram mooy jamono boo xam ne feebar ñëw na si yaram bi moo koy xeex corona daf su duggee sa yaram bi dafay nekk ba 14 days balaa ngay yëg ne am na lu dugg sa yaram bi mandarga am coke yu metti boppa kof balaa mooy ñëw daa fekk about 14 days la waaye soo jëlee pengu bi alhamdulilah incha allah ko da nga am ay soldaar yoo xam ne si seconde boo xam ne feebar bi bu mu ñëwee dafa koy commencé xeex loolu benn la kon yow da nga ci mën a mucc ñaareel bi mooy yow doo nekk sabab incha allah pour yóbbu corona bi si kër gi comme si jaayte nu mu ko doon wax am na ay kilifa yu nga xam ne mbaa yéen ñu feebar ñu mel ni feebar yi deret moom attention feebar yi diabète feebar yi asthme ñooñu yëpp ak yeneen chronique condition yoo xam ne ñoom su fekkee ne am nañ feebar bi rek dañuy gaaw a lor kon su fekkee ne jël nga pengu bi tam am na solo pour yow doo yóbbu doo tasaare feebar boobu noonu si kër gi waaye ñetteeli affaire bi mooy economic reasons waaw because gan yi nga xam ne ñoom ne ici comme fii ñoom duñ ñëw si réew bu nga xam ne seen pengu mu ngi des ndax tey suñu buggee ak suñu buggut amul benn pexe boo xam ne àdduna bi mu ngi ko teg si table bi pour xeex corona raw lan pengu loolu nit ñi war nañ ko xam te pengu bii nii Mr Ceesay dafay continuer su yàggee comme ni ñuy demee noos Gambien ñu ñuy déglu feebar yu mel ni cere yeneen di ko wax ngas payis tétanos jaddaaral loolu yëpp feebar yoo xam ne rey na gu doomi Gambie ak gani Gambie yu bari fii te feebar yaa ngi fi ba léegi waaye lan moo tax nekkul di ñëw mooy nangut bu nga xam ne suñ kilifee góorgóorlu boot seen doom yi dox yu métti fekk na saret amut saret sax jafe la woon man maa ngi juddu si kaw gi fekk na saret sax problème la woon waaye dañ doon dox yu métti jàppale lay wér gu yaram dama bëgg réew mi ñu hóolu wante nen hóolu wante xalaatal si su fekkee ne nit ñi xooluñ teachers yi foog nga ni xale yi dañu jàng su fekkee ne Gambian bi xoolu ñu liggéey si wér-gu-yaram kanaa kon ñun dañ mën am wér-gu-yaram Ministry of Health depuis 1979 ñu am programme ñun suñu office suñu responsabilité mooy gis ne bépp doomi Gambia ak gani Gambia mucca na si bépp feebar boo xam ne da nga ko musal si pengu comme pengu yu dem noos suñu ak ni ko melak programme bu yoree pengu noos bu ñuy joxe si réew mi fii programme boobu moo yore pengu pour corona bi beneen feebar bu su ñëwee nan boo xam ne dañ koy xeexee noonu nit dañ programme boobu moo ko fi isi waaye pengu mi nu muy demee because comme si Sekundaay soo leen waxee ne pengu bi dafay musal feebar dañ la wax ne noonu naka la mën a mene waaye lu xew mooy corona bi soo jëlee pengu bi si kattan yàlla subhanahu wa taala dafay foogloo pengu bi dafay foogloo deret ji ne feebar ñëw na feebar ñëwut waaye luñ ci nama mooy jamono bu nga xam ne feebar ñëw na si yaram bi rek deret ji moom dafay ut soldat pour ko xeex léegi dañoo joxe pengu bi pour deret ji foog ne feebar ñëw na fekk feebar ñëwut pour mu defar soldat yu mel noonu ñu ngi fi am nañ ay soldat am nañ fi ay navy am air force am ground force yi yëpp dégg nañ ko fi foog naa si xeex yu ñëw si jamono léegi façon xeex yi nii yëpp dañ ko pour deret ji mën a defar soldat da nga si ne ëllëg feebar su ñëwee rek soldat ñooy dem xeex ko rey ko balaa ngaa yëg yow sax feebar bi ñëw na. loolu moo tax lu am solo la
si campagne bi fan ak fan ngeen dee dem.
alhamdulilah comme campagne bi si jamono soo mu ngi si Gambie yëpp every region si lopitaan bu nga xam ne mu ngi amee non si réew mi fii am nañ ay team ñu xam ne suba bu nekk si fukki fan yi dañu koy dispasse dem si dëkk yi dañuy nekk si Bantaba yi nekk si penc yi nekk si crossing points ak si lopitaan yi yëpp waaye nag Cissé am na solo pour nit ñi xam ne after campagne bi dañuy continuer after campagne dañuy continuer this is just the intensive phase lopitaan boo dem rek incha allah da nga am pengu bi te pengu bi dañ ko jox xale juróom fukki at ak ñaar dem fukki at ak juróom-ñaar ak fukki at ak juróom-ñett dem si kaw ñetti pengu moo am si jamono yaa ngi am Sinopharm bi nga am Pfizer nga am Johnson and Johnson vaccine waaye yow loolu bu mu la jaaxal soo demee si table pour jël pengu bi ñuñ fa taaj ñëw xam ne ban pengu nga war a jël. mu la mën a jàppale
leneen laa bëgg a xam rek parce que am na ñoo xam ne gom nañ pengu bi. soo ko jëlee ndax jar na pour nga ñëwaat nga ne baa ma jëlaat pengu bi xam nga am na ñoo xam ne moom.
waaw exactly des na fi mu ne nii pengu bi xam ne ñu ko jox xale yi. fukki at ak ñaar dem ba fukki at ak juróom-ñaar ñoom pour nga am soldat yu ñu soxla pour mu def ko sa yaram bi man la garder pour feebari corona da nga war a jël ñaari dose te lu ci gàtta gàtta war na nekk diggante first dose bi ak second war na nekk at least ñaar fukki fan ak benn so ñun dañuy wax ne soo jëlee first dose bi second dose bi si benn weer bi mën nga ko jëlaat loolu moo that's very important so waaye ñu nga xam ne amoon neen J&J moom mooy Johnson and Johnson bi after 3-4 months mën nañ jël Pfizer benn dose rek la ba pour yokkal la comme lu ñu ne njogonal xam nga soo añee
bala xam naa njogonal mas ñu maam say ngoom yi suñ caméra bu
njogonal ci la bokk booster bi mooy njogonal bi mooy yokka doole bi because vaccine bi soldat yi soo ko jëlee dafay dem ba si kaw waaye su demee bi yàgga day commencé wàcc soo jëlee lifin bi rek booster bi dafa ko yóbbu 100% again to the maximum level protection moo xam ne yaa ngi ko am so loolu lañ ci
njogonal bi la
loolu moo nekk njogonal
bi la Youssoufa Touré war na dem jël njogonal moom tam
waaye njogonal bi war nañ ko jël man jël naa njogonal bi I've taken the booster and a lot of people are taking the booster in fact it's very important Mr Cissé pour ñu wax ko si kàllaama wolof gis nga si ñun si office bi gis ko bi barcode bi ñu ngi am a lot of trouble because li xew mooy nit ñi duñ ñëw teel
waaw
ñëw leen jël pengu bi jël leen pengu yu tukki su leen ci fekkee mu gën a yomba léegi da nga gis ne ku war a dem ëllëg war a am vaccination te internationally so da nga war a jël pengu bi 14 days balaa ngay travel so ñu ngi ñaax yëpp yuut si ndaw yi kilifa yu nekk fa so ñu ngi si school yaagu dara bengu nen about 100,000 12 to 17 years balaa school tëj léegi school tëj na waaye ñu ngi ñëw so bugga ne nit ñi neen génne xale yi neen jël pengu ñu xam ne tukki su ñëwee nañ dem si lopitaan incha allah
waxtaan mi nee na trop waaye nga rek waxtu bi def ñu jaamu fii lañ ko emale ba beneen yoon incha allah xam naa gaa nañ fi ñëwaat alxames soobee yàlla from 9 o'clock to 10 PM pour ñu gën a waxtaan si wàllu vaccine bi thank you very much Musa Camara for coming on the program and Umar Jaita as well. Thank you so much, gentlemen, for being on this program. Well, viewers, with that, we bring an end to this live program. As I said, we were discussing about the ongoing COVID-19 vaccination campaign being spearheaded by the Minister of Health of the Gambia to reach out to more Gambians as far as protecting the people against this deadly pandemic is concerned. I was your host, Aliu Ceesay. Do join us Thursday, like I said, from 9 p.m. to 10 p.m. Until then, bye-bye and have a wonderful evening.